Welcome to all my friends in healthcare. You are listening to the Bedside Manner podcast. This show was developed for female healthcare professionals by female healthcare professionals. So come on in, ladies, get cozy, and get ready to laugh, cry, and learn as you're introduced to incredible women from all across the nation and their one-of-a-kind stories, passions, and tangible tips to empower your life and career.
You are listening to the Bedside Manner podcast with your show host, critical care registered nurse, DNP student, nursepreneur, and lover of all the science, self-care, wellness, healthcare, and Harry Potter things, Dani Urness.
All right, welcome to the Bedside Manner podcast. My name is Dani, and this is...
Hi, I'm Malyssa. I don't know who all is in here, but I'm sure some of you know me from work. But so yeah, I'm an RN on the CVICU at Essentia in Duluth. So Dani and I are coworkers. That is one of the best things to come out of the CVICU combination. So
yes,
meeting new people, making new friends. So yeah, so I've been working as a nurse there for a little over 2 years. I hit my 2-year mark in July. And I was a new grad into the ICU. So kind of one of, I think at Essentia, at least one of the newer, like kind of the first round of people kind of to be a new grad in the ICU. So
would you go to school and just kind of tell me just a little bit about like why you just chose to be a nurse and like what kind of led you there?
Yeah. So I went to Scholastica, so in Duluth here. And my path to nursing was, I always knew I wanted to be a nurse, but I actually ended up going to randomly NDSU for my first 2 years.
Oh, I didn't actually know that.
Yeah. So, and actually I just like nothing against North Dakota or anything, but it wasn't for me. So I was really happy to move back home and I transferred back to, Scholastica, and I was much happier. So it took me, about 6 years to get my nursing degree, which was not ideal, but it happens.
Sure does.
And so, yeah, both my parents are nurses. So I've grown up with it literally my entire life. So my dad is a CRNA and my mom's a nurse practitioner.
Oh, great.
So yeah, I've literally known like nothing else my whole life. And I've always thought it was interesting and exciting, I guess. And I guess I never thought that I could like have a job that felt fulfilling to me. And like that was helpful to other people. And that also I actually enjoyed learning about and was interesting at the same time. So I really felt like nursing was like my dream job, to be honest. And I've been doing it ever since.
Awesome. So you've been in the ICU for 2 years. Mm-hmm. And so originally, so she was in CICU and I was in SICU. And here we have combined units. And so now SICU and CICU are now together. And there has been lots and many pros and cons to combining both of those units. But it's been really nice to be able to meet excellent, fabulous new people. So I think that's been great because the camaraderie has really been helpful to pull us through this whole COVID pandemic, and then just being able to just rely on people who are literally going through the exact same thing. And that's one of the main reasons why I wanted to start this podcast, was to just kind of let everyone know you're not alone in how you're feeling, and there's lots of things going on, and like there's tons of people who are brand new grads in the ICU, and I feel like for a lot of us, I was also a brand new grad in the ICU. I started in burn ICU, then transitioned to surgical ICU. So I transitioned into a cardiac surgical ICU. So there's just so many people who are literally going through the exact same thing, and that is why we are here. And one more thing really quick. Please forgive my sweet German Shepherd Husky mix named Tucker in the background of this episode. He apparently wanted to make a guest appearance too, and this podcast is all about authenticity, so I decided to just keep it in and not re-record, just to kind of let you guys know that everything in these podcasts are real and raw, even right down to the editing and the furry friends in the background. So Malyssa, could you please tell us about time management and being a new grad RN in the ICU?
It's probably, honestly, the answer I have is probably one that no one wants to hear. I really think no matter where you start as a nurse, time management is really just something that takes time. It really is. I think it's just an experience thing for the most part. So I would say that's one of the arguments for why people say that maybe you should be a floor nurse before you go to the ICU, because then generally speaking, you'll probably have your time management figured out. And then you maybe won't feel so overwhelmed. So you won't be trying to learn time management and how to be a nurse on top of how to be an ICU nurse as well. Yeah, so I think that's definitely kind of one of the arguments that people make for why you should or shouldn't do it. I was able to manage it myself, and I think it's just really a personal thing. I think either some people can, cope with kind of the stress of learning those things, and some people can't. And I think you just have to know yourself and I know it's hard for not everyone can do this, but if you have the opportunity, I mean, really try to be in an ICU for clinicals if you even think like for a second that it's an interest for your career. Because then you can at least have a decent idea on, if it's too much for you or not.
Yeah, I think you hit it right on the head. Really, time management definitely comes with time, exposure, and experience. And so, really, just getting your hands on whatever you possibly can during the course of your schooling will definitely help you transition into the ICU after graduation. So, on that note, what are other things that new graduate RNs can do to prepare for the ICU?
Okay, guys. So, again, not everyone necessarily has the opportunity to be in the ICU during school. If you do, and you even for a second think it's something you want to do, please take advantage of it. It's so important to get exposure and experience from that. I was very fortunate. I probably had 300 to 400 hours in critical care / ICU experience before I even started as a nurse, just because of the opportunities that were available at St. Scholastica and that I took advantage of. So it really helped me feel more comfortable starting in the ICU, and it really solidified that that's what I for sure wanted to do. I know that a lot of people think it's really intimidating, and it definitely can be. But it's like anything else, it's a comfort level thing. And, once you can kind of get exposure to it, and as long as you have a good team around you who can really help you succeed, then it doesn't really matter. I just think that you have to know if you want to do it or not is kind of the bottom line. So I think the main thing is really just trying to get exposure, even if it's not in the ICU, in some type of critical care setting. Like some of my clinicals are also in the ER, which I knew that that's not what I wanted to do, but it's still kind of like a stressful environment with sick people sometimes. And so it's kind of a nice way to get some exposure as well. So
So again, exactly what Malyssa just said, just make sure you're taking advantage of any opportunity to actually see if that's actually what you would like to do. Because once you're in it, you're basically in it.
I mean, of course, you can always like say no, this isn't for me, but it's better to know that up front than to start your job and then be in it for 6 months to a year and be really uncomfortable and really unhappy. And even, if you're on the fence and if you're not sure the ICU is for you, then I would say it's probably best to not start there, to be honest. Yeah. I think unless you're 100% sure that's what you want to do.
Well, that actually leads us right into our next topic here. So Malyssa, can you talk to us about the pros of starting in the ICU right away?
I mean, I think if you really want to do it and you're able to get into it right away, I mean, good for you. I think, because personally, depending on the person, I don't think it's necessary, to go through the transition of being a floor nurse. So I think it's a huge pro to like start where you actually want to be and really enjoy your job right from the beginning. Because I think a lot of people go to the floor or be a med surg nurse because they think it's kind of what you're supposed to do, and they end up really not liking their job or maybe getting burnt out before they even get a chance to move on and do something different. And I mean, I think honestly, that's probably like the overall pro. I think I've heard from other people too, is like new grads in the ICU, that it's really easy to teach you what's right and wrong in the ICU versus maybe like people who started on med surg or even just a different facility or different ICU might have quote unquote like bad habits maybe, or just policies might be different. And so it's a little easier to maybe like teach a new grad because it's kind of like a blank canvas, I guess, for better or worse.
Exactly.
It's really, you can just, teach them everything they need to know versus trying to maybe reteach somebody or like learn new policies or procedures. I think there's a lot of perceived cons being a new grad in the ICU, but again, I really just think it goes back to it's all person to person. I think we can both say that we've seen a lot of really successful new grads in our ICU, and we've seen a lot of people who have really struggled and they're not cut out for it. And so I think it's really just a personal thing, and that you hope that you have good preceptors and good managers that are honest with you about, if you are really cut out for it or not. And also just to be honest with yourself and kind of gauge yourself in it, see if you feel comfortable in the environment as well. And if you don't, then, I think it's important to also just like self-gauge and be able to say, I should probably start somewhere else, or maybe it's not for me right away. Mm-hmm. So
yeah, you're entirely right. You really have to be driven and have initiative, and you really have to give yourself grace. I mean, you're learning how to be a brand new nurse and a brand new ICU nurse all at the same time. And with any nursing specialty, this takes a lot of time and a lot of effort. And yeah, you have your orientation and you have your preceptors, but there's tons of work for you to do on the outside of the hospital. You need to be spending time going through your AACN Critical Care Essentials book, reviewing your unit-specific anatomy, physiology, and the pathophysiology, and all the ICU drips that correspond to your patient population. For those new grads who I did see struggle, they thought they wanted to be an ICU nurse, but either weren't able to put in the necessary time, or just like you said, Malyssa, either weren't being honest with themselves about really wanting to be in critical care. And this again applies to all specialties. And that's why it's so important to understand or to know if you really truly want to be in the ICU or really any specialty, because it definitely takes time to devote to those individual specialties. And if it's something you really want to do, you will put in the time. If it's interesting, you'll put in even more time, and you'll really be happy with where you are and what you're doing. And that leads us right into our next topic. You learn a lot about yourself in the first year or two of nursing in general, but just having to, you really learn to self-advocate. So I will let Malyssa talk a little bit about your experience having to self-advocate for anything and everything for yourself, and then becoming a patient advocate in the process too.
Yeah, you have to do both. You have to learn how to do both. But absolutely, I think, self-advocate and just being in self-discipline is really important when you're starting out in the ICU. They always kind of say a general rule is like 6 months to feel comfortable as a brand new nurse, and then usually a year to feel comfortable as a brand new ICU nurse. And I would say that's very accurate. So I think if you're thinking about doing it, be prepared for that. I would say I probably did not start to feel comfortable until after my first year, or at least close to it, and kind of feel competent in what I was doing. And I would say, based on people that I've talked to who are new grads, that's pretty accurate across the board. So, and, not necessarily that you're not competent before that, but it's a self-perception thing and it's a comfortability thing. And I mean, definitely, as Dani was saying, it is a lot of self-advocation for just like teaching yourself. Your preceptors will teach you what you need to know. You'll learn what you need to know to take care of your patients properly. But to actually like keep it, locked into your brain and, or, just build upon your experiences. I mean, you definitely have to be doing stuff outside of work or at work. I was definitely the person, like I was at work, and especially on night shifts, my first 6 months to a year, I would have like a notebook with me every single day, and I'd have like an ICU nursing book and a cardiac book, and I'd bring them all with me to work every single day that I worked nights, and pretty much I would be reading them the entire night shift when I had downtime. Because as we all know, during nights, your patients are mainly sleeping for the most part. So I would be reading up on things that I was unfamiliar with, or things that I want to get better at. And I would be taking notes in my notebook. So it was like a little quick guide for me to refer back to for when I maybe had really sick patients, or I encountered something that I haven't had in a really long time. So, I mean, I'm not saying you have to be like that to be successful in the ICU, but I mean, that was literally me for like the first year.
Yeah, it's being really diligent, and it's taking advantage of all your time while you're at work, when you have, and if you have downtime, to spend a couple minutes looking at things. And, because you need to advocate in that sense. And then you also need to advocate, in your orientation process, or within your first 1 to 2 years of, hey, I haven't seen this kind of patient yet. Can I shadow this happening, or can I follow another nurse doing this, or can I have an extra week or two of orientation? Because I asked for 2 weeks of extra orientation, both when I started in burn ICU and then when I transitioned into surgical ICU. I asked for the extra orientation because I felt at that time I did not see enough of what I had wanted to make myself feel comfortable. And so you have to ask for what you want, and like sometimes you don't get it, but at least you can ask for those learning opportunities,
Yeah. And I definitely, I remember being on orientation, same thing. I mean, I made sure that, during my weekly check-ins or whatever it was, that I absolutely was open and upfront about certain patients that I hadn't gotten the chance to see, especially, core population patients for my unit that maybe I hadn't felt I had enough time with. So, I mean, basically like structural heart type stuff, since I was on the cardiac ICU. So if I didn't, when I didn't feel like I had seen or had enough experience with those, I always made sure to ask. Not that it'll always happen, but at least you can be an advocate to yourself and put it out there. And if you have a good manager and a good preceptor, they'll try to make it happen for you. And another thing that I always did too, again, not that you have to, but, and it depends on the environment you're in. I work on an amazing unit. Even still that we're combined now, I've always had amazing coworkers who are very supportive of me. Which obviously makes a huge difference.
Yes,
I hope that every one of you.
Culture is so important.
It is. And I hope that every one of you is lucky enough to end up in an environment like that. So people were so always very helpful and nice to me and accommodating of questions that I asked, which I had a million of them when I started. And so like if I had maybe like 6 months in and there was somebody who had a balloon pump patient or a TAVR or post arrest or like maybe a really sick cardiogenic shock patient that I wasn't experienced enough to take at that time, I would, when I had downtime after I was done taking care of my own patient assignment, I would go and sit in the room with them and ask them questions about their patient. So, like, okay, well, what drips are they on and why are they on that? And what does this do? And why do we choose this over that? And really just getting to know the patient. And I mean, yeah, I would go into every like balloon pump route, because I thought it was like super interesting and I'd ask them about it. I mean, this was a year and a half before I was trained in to take those patients just because I thought it was cool and I wanted to know more about how it worked and why we basically put them in people, I guess, why is it necessary? So that was also something that really helped me, I think, just like make myself feel more confident and more competent within that year time frame as well.
Yeah, absolutely. It's so important to go ahead and put yourself out there and get yourself into those patient experiences, like Malyssa was saying about going into the intra-aortic balloon pump rooms or the post-arrest rooms or whatever your specialty is. Just getting yourself exposed to those patient situations will definitely help, 2, 3, 4 years down the road when you're being trained in or then being responsible as charge nurse for all those different patients. And again, there is no specific time you will ever feel comfortable. This takes at least a year of experience in any specialty to really feel, normal. Comfortable is kind of a wrong word too, because even now with 3 years of ICU experience, my surgical ICU unit was combined with a cardiac ICU. And so now I have a whole new set of patients that I now have to learn how to take care of and new interventions. And it's going to take time for me to feel comfortable doing that even now again. Serena in the live Facebook recording of this episode had a really good point here too that I'm going to share.
So Serena says, I'm sure even nurses with 5, 10, 15 years of experience are still seeing new things and coming up with new stuff constantly.
Yes, you are 100% correct. That's one of the new things, or that's one of the important things to recognize or to know or understand when you're starting out in the ICU as a new grad. It's not like one day you'll just reach your 1 to 2 years and you just know everything.
Absolutely
it's just not a thing. So so you will always be exposed to new things as our healthcare world continues to develop. And so you are 100% correct, Serena, that yes. So even as our technology continues to improve and better, and we get smaller devices, and we go from the balloon pump to all the other structural heart assistive devices there in CICU, so definitely we will always have something brand new to see eventually.
Definitely a lifelong learning job for sure.
Yes, exactly. You're not just done after your 1 to 2 years of nursing school.
Yeah, you're not an expert after like this time frame. Yeah.
Yes. Oh, and then another point, I talked to a lot of nursing students. The nursing students had said, hey, I am so worried about not knowing enough once I get into the real hospital world or into the real acute world, because I'm not getting enough clinical time, or I'm not getting enough grinding time in the actual nursing labs. Well, let me tell you, you learn most of what you need to know when you're out of school. On the job. Yes. So you go ahead, you study hard, you pass those boards. Then once you're in the ICU, we will teach you. Yeah. We were taught by fabulous nurses who I look up to every single day. And I work with nurses who I look up to every single day. They're incredible human beings.
We're very lucky.
Yes, exactly. Very lucky, super intelligent women and men, of course, because there are nurses. So then just kind of going back to what Malyssa was saying about needing to self-advocate and to educate yourself and having, you're writing things down and you basically have this like ongoing list of things you're building. You have your nursing foundation from school, and then you have your orientation, and then you have whatever unit you're going to be in. And so if you're float pool, this might not necessarily apply to you. But you need to know your core population well. And so then that should be your next step. You're really focusing on learning. And then just in regards to every single ICU, you should really have a, kind of like a wish list. How like you were talking about, I was going through like you wanted to know more about the intra-aortic balloon pumps because eventually you were going to be taking them. And so basically you kind of like write down your own wish list in your notebook of things you want to learn or things you should learn, because eventually one day you will have those patients and it will help you immensely. Even just looking at just the waveform, looking at the augmentation, and just learning a little bit more about timing and things will definitely help you in the year or so afterwards when you're actually licensed or licensed.
Yeah, certified, I guess. I don't know. Taught how to do it. Yeah.
So why would it be beneficial to not start in the ICU? If you aren't exactly sure or set on going into the ICU directly out of graduation.
Yeah, I mean, I guess the two main things that I always heard were time management was a huge one. Everyone said if you don't, you learn your time management on the floor, which, is true. I mean, 'cause on the floor, you might have 4, 5, 6 patients at a time versus in the ICU you have 1 or 2 max. So you definitely probably learn time management more quickly on the floors because you have to.
You don't have a choice.
You really don't have a choice because you have so many people you're taking care of. However, I guess, the argument for that is that the ICU and the floor they're different types of time management. Again, on the floor, you're managing several different patients at kind of like a surface level, so to speak. So, you're doing like focused assessments, and why are they here and those kinds of things. Versus in the ICU, you're really diving into pathophys and why is this happening and how the disease affects the entire body. And so obviously that takes up a little bit more of your time as well. It's just that you're doing it for 1 or 2 people versus 6 of them. Because obviously if you had to do that for 6 patients, nothing would ever get done.
Nothing would ever get
done. So that'd be my argument against that, I guess. Not that it's not important. I mean, I think, if you get into the ICU and you are struggling with time management, you're going to have a hard time for a while, for sure.
Yes.
I think if it comes naturally to you, you'll definitely have an easier transition. So again, that's kind of a personal thing. No one wants to hear that. It's really like a time experience type thing. And also another one that I heard is just kind of, you don't know what you don't know. So, which is true. I mean, you don't. So a lot of people said, basically if you start on the floor, for instance, if you're interested in being in the cardiac ICU, maybe you would want to start on, your post-cardiac floor. So for instance, we have the cardiac ICU, or we used to be the cardiac ICU, and then we have a post-coronary care unit, which is where pretty much all of our patients tend to go after they're not, don't need to be in the ICU anymore. So that, like, for instance, that would be a great place to start if you're interested, because you just see the less critical side of them, so to speak. But you still learn kind of about the policy, about the procedures, and like this like structural heart patients and stuff like that. So that was kind of a really popular comment that I heard too, is that you don't know what you don't know. And so it's easier to kind of learn maybe when a patient is like declining or going downhill, if you have experience on the floor, versus if you get into the ICU and you always have super sick patients all the time, basically, is that it might be more difficult for you to identify maybe when something is going wrong, or when to step in, and maybe your sense of urgency isn't as high as it needs to be. So those are probably the 2 most common things that I heard, for sure, for people who are not necessarily supportive of new grads in the ICU.
Yeah. And again, like all of this is just hard truth. It is authentic, and all this is real. Like, we are not going to sugarcoat this whatsoever. And so if you are a new grad in the ICU, you will probably hear some kind of a kickback in some sense, because some people strongly believe you do need to have experience coming into the ICU. And then that's where, like you can just say, I understand, but you know what? I'm going to do my absolute best to teach myself and to use my resources in order to prove to you, and to myself, most importantly, that I deserve to be here, because I'm going to work hard in order to be here.
Yeah. And that's, I just think be prepared for that, for sure. Again, I was very lucky. People are very supportive of me. There are always going to be people who are going to be welcoming of you, and there are always going to be people who think that you don't deserve to be here until you prove them wrong. Or until, you prove yourself competent in their eyes. So I think just be prepared for that. That's kind of everywhere though. But
yeah.
I think it's just a little amplified in the ICU, just because your patients do tend to be super sick. So I can't see what
was
Allie
just
said.
60s.
Yeah. 60s shout out.
60s shout out. Oh, this is great. So yeah, so mental stamina and emotional stamina are two big things you need to make sure you are pretty well solid on. You need to be able to get through your 8 or 12-hour shift, and then you have to get home and function. And I mean, you can't just drool on the couch when you get home, because girl, you have work to do. You have things to learn, you have things to review. Because even just with this combination, I have all these brand new things I have to learn now. Line pulls, line pulls were never a thing for me.
Yeah,
and
for sure.
So
and I'm taking post-op hearts, and we don't do that. So
there's all that, you will literally always have something new to learn, and you really have to hone in on what is going to make you mentally and emotionally strong, because like she was saying, you will have and can have a lot of negative comments, but you will learn to just go ahead and be stronger, and it will make you stronger. Being in the ICU, it makes you a whole different human being, most for the better, and a little bit of just your sass and your dark humor, just dark and twisty. You just get a little bit dark and twisty because you're just exposed to a lot. So next, we'll just kind of talk about, I do know there is a lot of interest in kind of talking about what's really important about just what you should really be able to do well as a new grad going into the ICU, and what you should focus on.
Sure.
And so things like complex assessments, and then knowing your vitals. And so just kind of touch base on a few things and your learning process on that too.
So I mean, definitely, if you don't have the basics of being a nurse kind of under your belt, or you're at least confident in them, for instance, doing a complex assessment, so a full body head to toe assessment that's in depth, because in the ICU they are very in depth. So if you're not confident with doing that, or passing meds, or giving stuff through a feeding tube, or kind of more I guess I don't want to say basic nursing skills, because not everyone experiences that, but if those things really make you nervous, or you don't feel confident in that yet, then you shouldn't be in the ICU. I'm just going to say that right now, because I think you will feel overwhelmed, and it will be really stressful for you. And then the other things, that you don't really have to worry about, I'd say, are don't worry about knowing all the medications, having them memorized. I mean, that just comes with time and experience and asking questions. That is definitely not something that you need to have, you feel like you need to have memorized before you go into the ICU. You will learn what you need to learn when you get there. But pretty much basic nursing skills, you need to be at least comfortable and competent enough, to perform head to toe assessment, and make sure you know your vitals, and at least sort of comfortable with some heart rhythms. I would say obviously just general, know what's good and know what's really bad.
Know which ones to shock and which ones not to shock.
Yeah,
super important.
Just know what's good and what's acceptable and what's not okay. And I would say just the most important thing too is just have one of the things I heard all the time too was have a sense of urgency. If you think something is wrong or going wrong, or you have a bad gut feeling, then you need to ask somebody about it, or tell someone, or do some more investigating, or whatever it is, because 9 out of 10 times, for better or for worse, you're probably right. And so I think there's a really fine line between being super anxious being in the ICU, but then also being way too laid back at the same time, especially as a new nurse. Maybe once you get some more experience, but as a new nurse, you need to for sure have a sense of urgency to know when to ask somebody for help or to say something.
Yeah, absolutely. And you never have to be afraid to ask questions. There are going to be nurses who won't accept you asking questions, and then that's fine. You can go on to the next nurse, because believe me, there are plenty of other people who are willing to help you, because they have been there too. When I started off in the burn ICU, I had the most amazing human beings teaching me, and I felt like I could always ask questions, and it was a wonderful experience. And the same thing happened when I got to SICU. Just a little bit more of that kickback to newer people being in the ICU, but it's just a culture. I don't necessarily accept that culture, and I have a whole another episode on that, but we won't dive into that. But there will always be someone who will and who is willing to help you. You do not be afraid to ask. These are people's lives you are dealing with, and this is your license. You have the right to protect your license and to protect your patients.
Yep. And I would say for sure, just as a little tidbit, absolutely, find those people who are willing to help you and who are good teachers. and who are willing to answer your questions, and really hang on to those people and make sure that you keep them close so you can have them when you do feel like you're in trouble. Because again, you are always going to have some people who are going to give you a little bit of pushback when you're new, kind of until they get to know you, and for, until to them, they think you're able to be in the ICU.
You got to prove yourself.
And and it is what it is. I just think you have to have a little bit of tough skin and just realize that that's going to happen. Because as Dani said, that I think it is shifting. That culture is shifting because we are seeing a lot more new grads in the ICU, but it's definitely still there. Some of those older, more experienced nurses, they all had to have their time on the floor because it wasn't an option for them to go in the ICU. So it's going to be there for no matter what. So just realize that. And, I think that just handle it with a little bit of grace, which is really hard to do sometimes. But just realizing too, that I think, we were all new once, and we all used to have questions, and we all didn't know everything at one time, or think we knew everything, or whatever the case may be. And so people just tend to forget that the longer that they're in nursing. And so some people can be a little abrasive, but I think, it's
a lot abrasive.
So it's just, kind of take it with a grain of salt and just try to not take it personally, because it's probably has nothing to do with you as a person. It's just
definitely not.
So
you really have to be able to be coachable. I think that's another really important thing. You need to be able to take constructive criticism.
Absolutely.
Because most of the time it's not going to be constructive. It's just going to be criticism. So first of all, you have to get to the ability to take constructive criticism. Yep. And then you have to be able to understand that when someone is giving you some kind of feedback, it's usually in a high stress situation. And so someone might be more apt to not say it as eloquently or as calmly as your nursing instructor would. And so you just need to be able to be coachable and just know if someone's giving you advice, it's usually for your own good. And the ability to be coachable is undeniably one of the most important things you need to be able to do as a new grad in the ICU, because you're learning to be a nurse and an ICU nurse all together in one. And there's so much to learn. And like you will never know everything. There will always be something for you to actually learn. And so you need to be humble, and you will have humbling experiences no matter how far you are in.
Absolutely.
If you ever meet a nurse who says they have made, or if you've ever met a nurse who has said they have never made a mistake, they are lying to you.
They are lying to your
face.
They
are lying to your face. We are human beings. And that's just the way it works. And so just be coachable and everything will be okay. In the end, it's sunshine and rainbows, right?
No. Some days, I guess.
Depends on the day. So tell me about what some of your misconceptions were about starting in the ICU as a new grad RN.
Well, and and I also, like I said, I got lucky enough to really almost all my clinicals, with the exception of basically my sophomore year, were in the ICU environment. So I think I had a decent idea of what to expect, because I did have great preceptors my entire clinical career. And so I did get really good exposure to it. I guess maybe I was surprised that even with all my experience and exposure, that it still took me a year to feel kind of comfortable and competent in the ICU. And I think maybe at 6 months or something, you kind of get a false sense of comfortability. Yes. And then it's a year, and then you're like, oh no, this is actually what it's like to be pretty comfortable taking care of these patients, and actually knowing what to do and intervene in the right way. So I don't know if that's really a misconception, but maybe just when people said, oh, it'll take you a year to feel comfortable, I was like, okay, I mean, I accepted that or whatever. I was prepared for that, but I guess I didn't really think it would actually take you that long. And it definitely did for me, for sure. 100%.
Absolutely. Same here.
Again,
for me, it's
probably a better question for you. Did you have, when you went to the ICU, maybe even from switching from burn to SI, were you oh my God, this is not what I thought it was going to be like?
Yeah. And so I don't know if there's any people watching who were in SICU, but I did not know there's again, I didn't think I was qualified to land open heart patients. However, I had this misconception that once I started there, that was the patients I was going to be taking. And I didn't think there was this like grace period of you get to learn how to take care of post-op day one patients instead.
Yeah.
And so I literally spent like a month of that summer before I started in SICU, like learning almost everything I possibly could, because I was so sick to my stomach about having to land open heart surgery patients. And so, but again, that was a misconception. And just so I was an LPN for 3 years, and I worked in rehab, and then I went from rehab nursing into burn ICU, and burn ICU is an ICU with burn patients, obviously burn intensive care. However, there was a lot of overflow patients. So it was like one of the best transitions from LPN to RN. But just from the misconceptions of going from, I have nursing experience, I think it's going to take me that much longer either, because I already had learned, basic nursing interventions. However, I don't. So like, no matter when you're transitioning into any ICU or into any new floor, there is a learning time, and you do need to give yourself that grace and
have patience with yourself. Which I was really bad at that, just to be honest with you. I was like super, like, I was frustrated that I didn't feel more comfortable sooner, because I just felt like I should, I guess, but that's just me as a person. So, but try not to be hard on yourself, and you are going to make mistakes, and just try to, it is what it is. Everybody does, and it happens. And just try to be patient and kind with yourself. I was definitely reminded of that several times already throughout my 2-year career, to be a little bit nicer to myself and not quite so hard on myself. And I think that's a really important thing to do. Like, it's already hard enough to learn how to be a nurse and learn how to be an ICU nurse. You don't also need to be like your own worst enemy on top of it. So that's just going to make your life miserable.
So exactly. The more time you spend hating on yourself or thinking you're doing something bad is more time you could have been spending reaching out for help, or for working on your mental stamina, or just focusing on your mental health. Because believe me, it is so important to work on your mental health as a new ICU nurse, because you have this like imposter syndrome of, am I going to make it? Like, am I doing this good? Like, what am I doing? Or some days, so some days you leave work feeling like $100 or $1 million. And some days you're in your car, even after 2 years, going, you just drive home with no music on. You're like, okay.
That's a bad day when you don't play music in your car on the way home. It is. It's true. You'll have days like that no matter what. And I think, the more experience you have, they're probably fewer and far between, but definitely when you're starting out, it might be every week that you work, you might have like a really good day, and then you might have a really bad day where you really feel like you're just not cut out to be there. And I for sure went through that a lot during my first year. A lot. Yep. Lots of tears, lots of self-doubt,
lots of wine.
Yep. So it is. And that's just another thing where, if you're the type of person where, you can't handle that, or you just don't want to, some people don't want to have a stressful nursing job, and that's fine. And, so there's plenty of other options out there. That's why there's, all these different types of nursing you can do. There's something for everyone. So
on that exact topic, brand new grad nurses, you going into the ICU, or just new grad nurses in general, you need to find who your people are. You need to build friendships. You need to build trust within the people you are working with, because when a code blue happens, or when it hits the fan, you need to be able to trust and to at least have a professional relationship with who you're working with. And so building trusting friendships and relationships at work, and just knowing who you can go to for help, is going to help you immensely. And there's always going to be someone who can help you. Like I had a crazy day, and I had a scan downstairs, and it was shift change time, and Malyssa came to the rescue at the end of my shift, and we just worked together to get the patient all cleaned up and taken care of. And there's always one more thing you can do for someone you are working with. There's always one more thing. So just always try to go above and beyond, not just for yourself and for your patients, but just for everyone in your unit,
for each other, for your coworkers, for sure.
Yes, like bringing in really good food, or muffins,
that's
or
a tip,
everything. Sure. Yes, bring in all the
just always
goodies.
feed people. You'll make friends really fast.
Yes, absolutely. Is there anything else you'd like to share with new grad RNs as they're going through their orientation?
Precepting is, I'm one of the maybe rare people who I enjoy precepting and I enjoy teaching, but it is hard. And it
really
is
hard.
stressful and it is time consuming as well. And it's just a different mindset, you know, especially once you're established. You know, you have the certain way you do things and you just kind of go through the motions. And so to kind of stop and take some extra time and explain what you're doing and why, it just,
Like, oh,
you
wait,
know,
I
it
should
takes a
get
little, yeah, it takes a little extra mental energy. And so, just to make sure you're thankful to the people who did help you when you were, you know, learning. It is really important, and it's an important job to have. Just make sure you're thanking people for taking the time to do it, for sure.
Yeah, and I can whenever I've had like a student or anything along those lines, you know, they were so gracious and had given a gift card or coffee or something, and so just all those little tiny things really does add up because nursing is typically not a thankful job. Like patients don't really get the opportunity to thank you because they are usually too sick or they're intubated. So it's
or you have a day off and they're gone or like whatever.
Yeah, exactly.
You know, I don't know.
Exactly. So don't forget to say thank you to everyone around you and just so on the side of like being around positive people, you also have the control to be a positive ray of sunshine on your shift too. You know, if there's a problem, you can talk to someone about it and just don't bring down the energy of the whole unit. Like just check yourself when you come into work, leave work at work, harder. It's super, super, super hard, but then also leave home at home and just try to have, it's really hard to do. And it's like, I'm finally just learning how to keep work at work. And I've been doing, you know, I've been a nurse in between the L and the R for over 6 years now. So I'm just understanding it like this year. So
yeah, it is. It's a really hard thing to learn for sure. I think for anybody. Yep.
Yeah, so I think that kind of wraps up on all the questions we had and kind of the things we wanted to touch base on.
Yeah.
Becoming a new ICU nurse or a new grad ICU nurse straight out of school. As you can see, she is a very beautiful human being, and she, if anyone here works alongside her, she literally love is mutual. Like you can. She always has the most well put together outfits and her hair is adorable. She has like the cutest accessories going on. And
I do not look like this at work. Nobody's ever seen me this cute at work, but
yes,
I mean,
she is always cute. She is seriously always cute. And so self-expression at work is so important. So Malyssa, go ahead and tell us why self-expression, even in your own work uniforms, is so important.
I mean, I guess for me, it's just important because, I mean, I guess I've never done anything really different. I don't know. Maybe when I was younger, I would kind of like, you know, follow the status quo or whatever. But nowadays, I'm like, why? I don't know. Life is too short. You do you, you know, like if, you know, there are certain things that make you feel good or like it's easy as doing your makeup when you go to work or, you know, having your hair done or whatever it is.
Then having a really cute polka dot or some kind of
like headband. Yeah. Or like do the dang thing. I don't know. You know, it's like we all have to wear boring scrubs and like, I don't know. We all look the same, you know, especially now that we're wearing masks and scrubs. Like literally it's like half of us, like you can't even tell who's who anymore. Like I swear. So yeah, I don't know. I think it's just important to, you know, just like keep yourself at your core no matter where you are at work or out and about or whatever, and just do what makes you feel good about yourself, you know.
Yes. And don't buy dance clothes. Do not use them.
Yeah, no, work. You'll literally break your ankle.
And I don't know if Allie is still on there. Yeah. But like she has a story. Like I have a story. Like
Allie almost broke her ankle. Yeah. I've almost broken mine multiple times. I literally, I was about 2 weeks in and I was like, oh, my feet feel so much better, but I almost broke my leg. So not worth it.
I mean, they do help foot pain. Like don't get me wrong. Like I don't want dance school to come like after us saying, oh my gosh, these two nurses.
They do what they say. Like they prevent your foot pain and they prevent back pain. You are at risk for breaking your ankle. Yes. I don't know who.
And if you're clumsy,
it literally is. Yeah.
I'm clumsy and I literally took I don't think
it's unreal.
I don't think I was in the ICU for maybe 6 weeks into my orientation, like in burn ICU, and I literally took out an entire tray table in front of my preceptor in front of the patient, and it was like a very stoic nurse who was just like,
Are you
you
okay? Yeah.
I'm like just beat red, embarrassed, and like I can barely feel my foot. I'm
You're
like,
like, no, I'm not okay.
Oh my gosh, it's fine. I'm like, and I literally like never wore them again. And it was just, I can't.
Same thing. I think I tripped in a patient's room once and literally almost broke my ankle. I'm pretty sure it was Katie Knight saw me. She's like, oh my God. She's like, are you okay? And I was like, yeah, because I caught myself. Thank God my patient was intubated. They didn't see anything.
So stuck the landing.
Yeah, it was. And that was the last day I wore dank scales. It was never again. Never again. Really,
what does this one say?
Ran
to a cold blue. Yes. Ran to a cold blue from the cafeteria and twisted my ankle twice. Oh my gosh, Allie.
Literally.
Yeah. No. Oh no.
I don't know, guys. They're not safe. It's like a safety hazard.
It is. Like, I think they should come with like a written warning on the box.
It should. Yeah. Just like buy really comfortable tennis shoes and call it a day.
Yeah. And then have your really fun color pop like in your socks.
I wear fun socks.
That's what she does.
Yeah.
It's like super
I wear
cute.
really
like,
bright socks.
Hot pink socks. Like I always know it's like pink day. She has her like pink like accessories on and then she has her pink socks. And so you can get really fun even though you have to wear the same boring color scrubs
every single day.
Yes, like don't be afraid to self-express. And you know, if makeup is your thing, great. If it's not, great. Like you do whatever makes you feel comfortable. Because I know for me, it makes me feel more professional to have something on my face and to present myself because it's imposter syndrome. So you're going into the ICU and you're like in your 20s and you're taking care of people who are in their 60s and 70s and they just think you're like a little child.
Like you're like a child.
Like are you even old enough to
work?
take?
Do you even work here? Are you old enough to take care of me?
Yes. So having that little bit more of like put together face on like helps to make you feel more confident and being able to talk to.
Now it doesn't matter because all they see is this half your face anyway. So how's anybody gonna tell?
All you can do is this, and I feel like I can get like all these lines across.
But under normal circumstances, I did used to wear makeup to work, and then we had to wear masks every day. So now it's just really not worth it for me.
Yeah, and the whole mask me thing, girls can if there's people so like it is so bad.
It's so bad. It's like, a real thing. Yeah, it's terrible.
So if you have any tips for dealing with mask me, like put them down there and like share them for everyone to know because I finally found a couple products where it has helped, but just I feel like we're going to be in this for the long haul. So any tips, please help us share and I will share them more. But so again, thank you so much, Malyssa, for being here.
Yes, thank you for having me. Hopefully I'll see you guys again on here.
I'd love to have her back.
I'm so proud of Dani, honestly. Like, I don't know how she does this. She's like a superwoman. Literally is in school. She works. She's doing this. She goes to the gym every day. Like, I don't understand. Just throw a child in there next or marriage or something. And just kidding. She's not ready for that. But still, I'm like, literally, I don't know how she does this. So seriously, like, kudos to her. This is amazing. So proud of her. Like, chase your dreams, people. I don't know. I was like, you know what? If you don't do it, nobody else is gonna do it for you. So
because like believe me, like I'm like the last person who would have ever thought she would have wanted to do a podcast with a little underlying speech impediment. But I'm like, you know what? Whatever. It's gonna be what it's gonna be. And that's exactly what we're going to do here, Malyssa. You and I embraced this episode and we embraced each other's company and we were really able to dive into all of those questions. And again, thank you from the bottom of my heart of being on here. And this episode is really for all healthcare professionals transitioning into their career as new grads or transitioning into a new field or specialty. This episode is for you. And so here's a big shout out to every single one of you women grinding out, dreams, going after your goals. You got this. We have all been beginners. We all have to start from somewhere. So with that said, until next time, guys, cheers.
Thanks again for tuning in to the Bedside Manor podcast. Before you head out, don't forget to subscribe to get instant access to all upcoming and future episodes. Connect with Dani and her team on social media at Bedside Manor Podcast and at Danielle Elizabeth _RN or our website at www.danielleelizabethblog.com.